This is one of the many ingrained paradigms in healthcare that hospital food is hospital food.
This project started when the Ottawa Citizen had an article about how bad the food was at the hospital.
That was hard to hear because I knew how hard everybody worked to try to provide quality food. It was a real opportunity for us to change that around and turn the food into being part of the healing process and part of the patient experience. I had a chance to work with Stephen. I came to us with a vision of trying to change food and make it different for patients and improve healthcare through food.
There are three main goals with this trial. We're looking to improve the hospitality that is delivered to our patients. We're looking to improve our sustainability in terms of what we deliver to our patients and how much waste is created or not. And the last part is we're looking to see how much extra nutrition we can offer to our patients as well.
It's great to see you again. Thank you. Here's lunch today.
Through my involvement with the Canadian Malnutrition Task Force, I'm deeply aware of the impact and just the extent of malnutrition in hospitals. For patients admitted to Canadian hospitals, data has shown that about 45% of them, the ones who stay 2 days or longer, are actually moderately to severely malnourished. And in general, patients with malnutrition stay in the hospital longer, have more complications, more infections. They lose functional abilities.
The main reason why I'm here is my mom passed away of cancer 19 years ago. She was a patient at the General. I didn't know much about nutrition at that time. I knew about tasty food because I own restaurants. But through this process, I've learned a lot about nutrition and worked with some of the world-class dietitians that are at the Ottawa Hospital and learned that administered properly, food can heal you. Today we're going to do some protein-packed fruit smoothies. We're trialing this with some patients in both campuses this week and over the next couple weeks. And this one has gotten a lot of rave reviews, not only amongst the patients, but also amongst the staff. We're focusing really on beverages during this trial, and we'll be dealing with food later. And so what we're really trying to do is seeing if from the waste savings, we can put that money back into better, higher quality food and nutrition. Are there better options for patients that can be consumed better? Because if it's difficult to eat, if the packages are difficult to open, then people are not going to get the nutrition that they really need.
Thank you guys. Wow. It's full of flavor, packed with flavors. It feels like
Okay, so this is our falafel with warm tabbouleh salad. This is our Asian coconut milk and tomato chicken. We created 30 new dishes, and so we couldn't taste test 30 dishes all at once. The whole idea is to be able to get feedback from a very diverse group of people, from the dietetics team and the food service team and the management team, so that we have a real broad perspective. We can adjust the dishes as needed for the patients for our trial.
I'm sure the wow factor would be definitely there because
They would like.
I think they would be willing to try this.
These were all prepped using our ovens.
Here's a copy of the full menu. We haven't settled on which day of the week, but every day they get a choice of 2 breakfasts, 2 lunches, 2 dinners, and then 1 of 3 snacks. In order to prove that this trial is successful, we needed to make the data bulletproof. So over the next 20 days, we are going to survey 4,000 individual trays. That's 65 patients a day, 3 meals a day, for 10 days on the trial and 10 days off the trial. So you'll have some trays on top and the cutlery on top. You offer the 2 things, so you say, good morning, Mr. So-and-so or Miss So-and-so.
So the popular choice, as is right now, is the salad. very nice to show on the iPad. You know, it's totally different than usual. All of them were good. I tried this and that, and my family, they also tried this. Ooh, they said, ooh, that's good food.
If you are sick like me, I couldn't eat, but he pushed me. He said, I have to try this. You know, even if I can, I don't want to be discharged tomorrow and I didn't try this.
We're going to measure in a minute if it's not obvious. And then this is the soup. So they didn't touch it at all. So put 0. And it was the chicken rice.
So when it comes to intake, what they're measuring is percentage that's eaten, and then how much protein and calories that they're eating. So it's not a perfect measurement, but the scale of this is enormous. So it's going to give us an idea of total calories and protein, and those are the main kind of measures of when it comes to intake.
So we just grab an iPad, say hi, and then we go over there.
Eating processed food, packaged food is very difficult for a lot of our patients. And so having this opportunity to have healthy, fresh made meals presented to them, and they have a visual choice between 2 things at each meal, I think has gone a long way. I've had patients and their family members stop by the office to say how happy and excited they are to see fresh salad and all of these things that aren't normally on a hospital menu, and I don't want it to stop.
I've had the good fortune of pleasing many people through food over a course of 38 years now in the restaurant business. But there is something very different when you are connecting with patients and recognizing that you're part of the clinical team that is here to make them better. On the trial menu, we increased calories by 9%, protein by 10%, and fiber by 40% over the current menu.
We have tons of opportunity to expand our produce selection from Canada. And when you asked me that 12 years ago, I would have said that was not feasible, possible, or could be done. Stephen has shown us that this can happen. We can bring in fresh vegetables. We can scratch cook again in a kitchen and manage those costs in a sustainable fashion. I'm sad that the trial's over. I'm incredibly proud of the results, and I'm incredibly excited about what we can get in the future with this program and as it expands on. And I don't think we're going to be able to wait. I think we're going to have to start soon. So this is a really exciting time.
It is so gratifying. It is so important to my life's work. And I recognized I'm hooked now, and I want to keep this going. I want to keep the momentum going, and I want to make sure that so many more people in Ottawa get healed through food.